In today's episode, we are talking about ADHD and medication. Now, today's guest, Dr. Helen Reid, is a psychiatrist and she is able to prescribe ADHD medication, and she talks about tweaking and changing the medication. However, she is not your personal doctor. So please listen to this episode as guidance and some help and support. But if you are changing or tweaking your medication, this has to be done through your titrating prescriber and your doctor. So I just wanted to flag that up before today's episode. Welcome to the ADHD Women's Wellbeing Podcast. I'm Kate Moore-Youssef, and I'm a wellbeing and lifestyle coach, EFT practitioner, mum to 4 kids, and passionate about helping more women to understand and accept their amazing ADHD brains. After speaking to many women just like me, and probably you, I know there is a need for more health and lifestyle support for women newly diagnosed with ADHD. In these conversations, you'll learn from insightful guests, hear new findings, and discover powerful perspectives and lifestyle tools to enable you to live your most fulfilled, calm, and purposeful life wherever you are on your ADHD journey. Here's today's episode. Hi everyone, so welcome back to the ADHD Women's Wellbeing Podcast. I'm Kate Moore-Youssef, I'm your host here as always, and today I'm absolutely delighted to introduce a fantastic guest, Dr. Helen Reid. Now, Dr. Reid is an experienced consultant psychiatrist with 30 years experience in the NHS, most recently a lead for ADHD at a large London teaching trust. She has many years of experience with neurodiversity, both in ADHD and ASD, and their many comorbidities. Dr. Reid is also a trained individual and family psychotherapist, particularly specialising in cognitive analytic therapy, and her psychodynamic cognitive understanding and strategies really help in the journey of self-understanding and formulating a treatment plan that actually works. That's what we like to hear. Dr. Helen Reid has a special interest in rejection sensitivity, which we will be discussing in today's podcast, and other emotional issues which are so often part of these conditions. And last but certainly not least, Dr. Helen has ADHD herself, and as do her children. So Helen's advice, support, and experience to parents is firsthand, reflecting the often difficult family journey she has taken with many difficulties and many successes along the way. Dr. Reid's lived experience of ADHD means that her treatment plans are always from the inside. She lives in London, and her practice, ADHD consultancy, specialises in neurodiversity. Dr. Helen Reid, welcome to the podcast. I'm so delighted to have you here. I know how busy you are, and I've waited a long time to speak to you because I know how much all the listeners are going to get from this conversation. So welcome.
Thank you so much, Kate. It's wonderful to be here. And may I say, first of all, how much I really appreciate your wonderful website and your lovely podcast, which I'm a fan of, actually, whenever I have time to listen to it. So thank you for all that you do for ADHD as well.
Well, listen, thank you so much for saying that. It means a huge amount, especially when it comes from psychiatrists, it comes from GPs. I do get a lot of messages from GPs saying, I don't have many resources to offer you, but here's a good podcast to listen to. So it really makes me really happy to hear that. But my biggest thing is bringing experts and specialists like yourself onto the podcast so you can really explain to the listeners what's going on the ground right now, what's the most up-to-date research, evidence. So perhaps maybe you can kind of give us a little bit of an idea of what's evolved in your practice while you've been working in this field, and I guess the change in patients as well.
It's been an evolving thing. I've been a psychiatrist for 30 years, but certainly in the NHS, I only took over managing the ADHD service. Oh gosh, time flies, doesn't it? I'm going to say 6 years ago. It was about 6 years ago. And I left the NHS about 3 years ago because really this private consultancy that I do has took off such a lot. And I found it a better place, a better platform really in which to kind of bring the things that I wanted to my clients. So yes, ADHD is a massively changing specialty. It's evolving in front of our eyes, really, and it is so exciting, as you say. Now, 30 years ago, we didn't really have much of a concept that ADHD was a thing really in adults. I mean, it's only been a fairly recent thing that people have accepted that ADHD kids, by and large, will grow up to be adults who either will still fulfill the criteria for a diagnosis of ADHD, but we don't grow out of our dopamine brain. So whatever age you are, there will be things that we can learn from understanding how this type of a brain works. And I think really this, for me, ADHD is a patient-led specialty, and I think all the wonderful change, all the huge sort of growth in knowledge and awareness, it hasn't really been spearheaded by the medical profession. I think it's really been spearheaded by patients like yourself, patients like me, people who kind of find this thing out and it hits them possibly like a millstone might hit you on the head, and suddenly it explains a lot of things. And then of course we start to research, and I think that's where most interesting things are coming out of. And I think it should be that way, because I think having ADHD myself, and then obviously having come to it really through my children's diagnosis, my own diagnosis, it really kind of developed organically from what I was doing before, which was very much personality disorder, psychotherapy. I ran a crisis service for my trust for about 7 years, which was amazing. But I sort of, as I moved across to ADHD, it was really me realizing that in many of these places, we're dealing with the same people. We're just not giving them the right label. That is something I feel very strongly about. And the evidence for that really comes much more than from research, although there is some good research going on out there, of course. It comes much more from actually doing it, from like being in the clinic, for me knowing that people that I see now have very similar difficulties to people that I've seen before that perhaps have different psychiatric labels.
Mm.
And of course, a label is just a label, it doesn't matter, does it? But it does matter if, one label has a treatment which is really going to work and the other labels are, not going to bring us anything very effective in terms of our lives improving.
Yeah, some people say, why do you need a label? But actually, when you have lived not understanding yourself all your life, and you've, like you say, you've been misdiagnosed, put on the wrong medication, you're told there's nothing wrong, all these things, and that potentially has like brought on anxiety and depression. When you are then being able to kind of go, oh, so that's what it is. Now I understand. That label is very, very impactful. And, there's this sort of term being bandied around, being coined, of like women like us. We're this sort of lost generation who have flitted around, to therapists and psychiatrists, and we've been given different diagnoses that just haven't quite sat with us, or we've not been given conclusive help really, or just kind of been left to deal with things. And then we are finding out in our 40s, 50s, 60s that actually it's ADHD. We're able to connect these dots. And that sense of relief alongside the grief and the sadness is profound. And I've said this before, but I don't know of another clinical disorder, difference, whatever you want to call it, that ticks all those boxes the way ADHD in women does. That's why I feel like it's so topical and why it's so profound when women especially getting these diagnoses. Are you seeing that as well?
Absolutely. I mean, if you would have said to me 5 years ago that, I would have narrowed, my focus from the whole of psychiatry to neurodiversity, not that it really is narrow, but it sounds a bit narrow, doesn't it? And if you would have said, well, you'll be basically kind of diagnosing one thing, you'll be talking to people about one thing, and you'll be doing it every day, year in, year out. And although I've never got bored with patients, I think it's something I notice very much in the clinic, that people hyper focus. We hyper focus on our clients, whoever they are, and right through the clinic, you've got people who are doing frontline stuff, helping stuff, reaching out to people. And it's something I think that ADHD people are very, very good at. And of course, we will bring hyper focus to that. So, but I would have wondered whether or not I might get bored to some extent and want to sort of break it up with some other things. Answer, no, I never get bored. And the reason I never get bored is A, because it's fascinating, but B, because of the massive difference it makes to people. And it's constantly wonderful. It's absolutely wonderful to be able to bring this to people, to have them sort of to validate what they've often had, when they book the appointment, if you like, this sense of, my goodness, there's something here, might finally explain, the years of struggle, the pain that I've been through, and of course, we ADHDs, I don't think, well, we're probably not alone in this, but of course, our emotions being what they are, we will tend to blame ourselves when something doesn't work. So,
Hmm.
you've had the drugs, they didn't work. That's because you're rubbish. You've had the therapy, it didn't work. Well, obviously you're rubbish, aren't you? And I think it's very hard for us to think, well, actually, it was the wrong thing, unless you get somebody who gives you permission to say, actually, that is you. And more often than not, at the end of my consultations, and they're in depth, long 2-hour chats, and I get a lot of information from people. So they're very detailed, but people still often want to check in before they go. Are you absolutely sure that I've got it? Are you absolutely sure that I'm not just lazy? And it breaks your heart, but also it's the most wonderful thing to be able to bring that to people, and it changes lives.
Yeah, couldn't agree more. In my community, I've got a membership community, and we've got a WhatsApp group, and it's such an amazing, supportive group of women. And it's women who are waiting for assessment, who have been diagnosed. And the most common thing I keep seeing is one of the women saying, "I've had my diagnosis today, but I still don't believe it. Like, I still don't believe it. Like, what happens if I trick the psychiatrist? What
Yeah.
happens if I've made it all up?" Like, they're gaslighting themselves, and they still, because this is years of the same self-talk going on and on. I'm lazy. It's my fault. I should do things differently. And then they've got that validation from an eminent psychiatrist who is saying that, yes, this is, you have ADHD on a very high level, or whatever they've been told. And it takes them ages for them to process it, actually believe that they've not tricked the psychiatrist. And again, I kind of think there's no other condition that I hear about where women, the self-talk especially, and that internalized conversation that we've had, and a lot of the conversations I have sometimes with my clients, especially when we do EFT, is breaking down the "I'm not to blame. It's not my fault. Didn't have to do things differently. It's okay to be me." Like all that kind of those limiting beliefs that they've had. It's like chipping away and starting new foundations again, isn't it? If like this new kind of like core self of, actually, all those things which I thought were, were things that were wrong with me, flaws, are actually, things I can work with. These are like strengths now that I can start to play with. And it's incredibly empowering having this diagnosis. But people are listening who perhaps can't afford to go private, they're waiting on the NHS, a very, very long wait, or they've maybe chosen that they're just not going to go down that route, and they've gone with a self-diagnosis. How can someone with a self-diagnosis that hasn't had that validation from a doctor start to kind of change that self-talk a little bit? What do you say?
I mean, I do say to people in my clinic, it's understandable that people will have this doubt. And to be honest, it doesn't sound true. I've got to say, if I'm listening to it with my logical ear, if I didn't live this stuff, if it wasn't my life, I would say, well, that's a bit preposterous, isn't it? Like, are you really saying that, 5% of the population have got this difference, which, responds like nothing you've ever seen before to treatment? Which I personally think is the most convincing thing about all of it. But, we're not talking about a sort of, are you blue or are you red? We're talking about symptoms that everybody has, and they are, continuously distributed through the population. So, we have all got a bit of ADHD, but that is not to take away, from the suffering of the people who are in the top 5%, which is where we currently have our man-made, and I do mean man-made, cut-off point. And if I was in charge of everything, I would probably bring that cut-off point down a bit. And the reason I would do that is because of the massive effectiveness of medication in this condition. And I know not everybody is on the medication journey, and I don't want to talk about nothing else except medication. But from my point of view, it shrinks down the giant hamster wheel of a person's life. And I think that it's really important for people to have the pressure taken off them. And, all our lives, I think we've lived with so much pressure. And part of it is that if you have this kind of brain, it's actually a lot more effortful to live in the world and to do the things that we're expected to do. So I describe that for people as a hamster wheel. I feel that, with untreated ADHD, your hamster wheel is just a lot bigger than everybody else's. And without exception, the people that come to my clinic are exhausted, overwhelmed, flat on the floor. They have tried everything, and I mean everything, and they don't know what to do next. And so part of what I say to them is, there's no prizes for doing it the hard way. really, if we can find a way to make things easier to accomplish these goals without killing ourselves with effort, then clearly that's going to be a good thing. So yes, I mean, a self-diagnosis, I think that if people understood more about the fact that the symptoms are continuous. So if you do an online questionnaire, and you answer honestly, as people will obviously do, and if it tells you that you've got significant symptoms of ADHD, well, that tells you that you're on that continuum, which we all are anyway. It gives you an idea of where you are on the continuum. And if the online thing says to you that you have quite a lot more of these symptoms than other people, and you're struggling quite a lot more than other people, then that's true, and that's all the diagnosis is. I mean, any mental health diagnosis is really, let's ask you about what the symptoms are like. Let's ask you what effect that has on your life. And, we don't doubt that with depression. I when I talk to groups of consultants about all of this, you can absolutely guarantee that somebody will put their hand up at some point and say, well, how do you know it's ADHD and not just someone who's a bit lazy? And yet, if I was going to talk about depression, you wouldn't get someone putting their hand up saying, well, how do you know that person's really got depression and not just a bit sad and miserable?
Mm.
We know it's somatic, it's not nature, it's degree. If you have enough of these symptoms that they're holding you back, that you're doing your best, you're exhausting yourself, but somehow you seem to fail to achieve your potential, well, that is what we call impairment criteria. And if you've got symptoms and impairment, that's where the diagnosis sits, really, and it is actually as simple as that.
So I wanted you guys to be the first to hear about the launch of my brand new, groundbreaking ADHD Women's Wellbeing Hormone series. Now, you may have seen me talk about it on social media, but the VIP mailing list is now open. So I want you guys to be the first to be able to get all the information. You're going to get the early bird pricing, and you're also going to get a bonus workshop with me, a bonus live workshop. I've been listening to you, and from my own experience as well, I found there's very little to be able to connect the dots between our health, our well-being, and our hormones as ADHD women. So I have interviewed specialists, experts, and thought leaders in their areas, all about women's health, hormones, and the intersection with neurodivergence and ADHD in women. This is a groundbreaking series. It's all on video, but you can also listen to it on audio. And you're going to learn how to manage your ongoing hormone, energy, and lifestyle challenges alongside your ADHD. And I've created this video series so you can finally access the guidance from experts to help validate what you have experienced with your hormones and offer you clear advice and support to move forwards with self-leadership and positivity to reclaim control of both your physical and your mental health. So please head to the show notes or my website, adhdwomenswellbeing.co.uk, to see the link. If you click on that, you will be on the VIP mailing list. So you get that early bird offer. Now, this early bird offer is only open for a few days, and then it's going to go up to the full price. So I wanted to make sure that anyone that listens to this podcast gets this offer. You have then got access to my bonus workshop where I'm going to be discussing and answering questions from all the different insights from the ADHD Women's Wellbeing Hormone series. I promise you, you are not going to want to miss this. I've not seen anything else out there like what I've created, and you are going to learn so much about how to empower and support, and most importantly, advocate for yourself with regards to perimenopause, hormones, energy, autoimmune issues, and ADHD. So head to my website, adhdwomenswellbeing.co.uk, and sign up for the VIP launch. I mean, it's crazy, isn't it, that we're still talking about this stigma and this taboo of ADHD. And again, like no other medical condition, psychiatric condition, ADHD is still, people who should know better are still making people feel bad about, talking about ADHD. And maybe I'm going to come onto the Panorama documentary that happened a few months ago. But the fact that a documentary like that was broadcast in this day and age, and which completely unsettled the ADHD community and made people like question their diagnoses, question their assessments, question themselves, the medication, like everything. and go back to that place of, well, maybe I am just lazy, or maybe I am just like messy or disorganized, and maybe I just need to just sort my life out. It's just, I think that's what kind of compounds it so much for people with ADHD, is that there's the shame and the embarrassment. And for women who again are only just discovering ADHD in later life, they've got to navigate this kind of old taboo and this old stigma, and talking about it and telling people about it, and having uneducated, ignorant people kind of go, well, that's what little boys have, and you don't look like you've got ADHD, and look, you've managed to hold down a job and you're successful, so you can't have ADHD. So on top of all the internalized exhaustion and overwhelm and all the things that we've been navigating, we then have to manage other people's expectations and opinions, and we've got to kind of think about that and think about the conversations and the accommodations that we ask for. And this is why I get so angry, but also so passionate to help empower women, give them the language, the insight, and the understanding, and the awareness, so they can come in and be like, actually, no, this is what I deserve. This is what's going on for me. This is why I've got this. And also, they can support their own children as well. They can support, because it's big work being a woman with ADHD, being a mother, looking after your children, making sure they're getting all the right accommodations at work, university, whatever, at school. And then something like the BBC documentary comes in and basically just steamrolls over all the hard work that many people have been advocating for. So I'm going to get off my soapbox. I'm going to ask you what you found after, what was sort of the paving of destruction that happened after that documentary in your clinic?
Well, the main destruction happened inside my own head, as I self-destructed with rage, like watching this program. As you said, it just, obviously people must be free to make programs if they want to, and obviously the chap who was starring in the program espouses a fairly normal societal but wrong view of ADHD. So, we're exposed to that stuff all the time. But Panorama gives it an authority, doesn't it? And an authority and a platform which it truly does not deserve, because, I think that it's not just the fact that they question the validity of ADHD, which I think we're used to. We have to go through that to get a diagnosis. I think it is a hard challenge, and I hope that will change over time. But I think also, more to the point, it had some really wrong stuff in it. Apart from the fact that they didn't really. I mean, I feel very sorry. They picked off some low-hanging fruit in terms of private clinics. Interestingly, they picked off clinics where doctors don't do the whole assessment themselves. And I really disagree that we should be promulgating an idea that somehow, if you're a doctor, you're this magic person and your questions have more validity than everyone else's. Those clinics are more affordable for people, and affordable is good. So I think it's a great, I personally have no knowledge of the actual clinics they have on there, but I do dislike the principle that you must go to a doctor. And the idea that you are supposed to have a 3-hour assessment from a specialist, I don't know anywhere where that happens. Private NHS only was. My assessments are 2 hours.
Yeah.
And obviously we had a lot of forms as well. But the idea that you could get that in the NHS, like, I was really angry with, to be honest, with the medical colleague who appeared on there, because the fact that he's an autism specialist rather than ADHD specialist does not help. And of course, autism is something that one does often have a 3-hour assessment for. So I think there was a lot of confusion about what the standard actually should be. In the NHS, I know, I work there, you will be very lucky if you get an assessment which is more than 1 hour long. And the chances are you'll get somebody who knows nothing about ADHD doing that assessment. And certainly when I left the trust that I was working for, I was replaced by a colleague, very, very nice person, but a colleague who knew nothing about ADHD at all, and in fact couldn't see any patients until she'd waited 3 months to go on a 2-day introduction to ADHD course. That's who you're going to be seeing. So that it was wrong on so many levels. And I've since discovered actually that some people who should know an awful lot better were briefing behind the scenes about that. So I feel there's some element of doctors trying to take back control of ADHD diagnosis again, which fair enough if you want to put your prices down. Well, if you want to do it, but people have to be able to afford it. We certainly, one place you won't see an ADHD specialist is in the NHS, and you're much more likely, and I'm sure we've both met people that this has happened to, who wait 2 years. Oh, you weren't late, you're not fidgeting, as you say, you've got a great job, you can't have ADHD, I'm not going to diagnose you. And I mean, that is just soul destroying for people to go through that. So I think the patients were really missing from that documentary, the people who actually have the diagnosis. And I see, and I'm sure you see every day, nobody, almost no one who comes to my clinic wants to take medication. I mean, it isn't the case that you've got people. It should be. If people really understood how great this diagnosis is and how helpful the treatment is, how well it works, they should be faking their symptoms. They should be like desperate to try, but they're not. Even people who really need this treatment, or perhaps especially people who really need it, have a real bias against taking medication. And a lot of them are very sensitive to medication. A lot of them have had bad experiences,
Yeah.
or just medication not working, which is in itself a bad experience, isn't it, really?
Yeah.
So it's just not true that people want the diagnosis. It's not definitely not true that they want the medication. I think people come as a last resort for an ADHD assessment.
Yeah, I couldn't agree more with that, because they get the diagnosis and then this hesitation with the medication, this fear, this worry. There's a lot of
Totally.
talk online and a lot of the forums, and it's very confusing and overwhelming, because one person will say this type of medication worked fantastically, but the other one didn't. And until there's a better way of deciphering, maybe from a genetic or a blood test, I don't know, I'm not a doctor, but a way of kind of going, there's a much higher chance that this medication will work for you. But also the way our ADHD presents as well. We may present with a huge amount of anxiety and mood swings, and one type of medication will be great for that. Another one is the physical restlessness, hyperactivity, the fidgeting, the nail biting, the skin picking. Another side might be the binge eating, more sort of like addictive side, and with from what I know, there's different type of medication that sort of work or not. I don't know, but I've heard that there's different types of medication which work better with more sort of specific areas of ADHD. But it can be very confusing, and it's also scary, isn't it? It's kind of like, well,
Terrifying. It's
I
it's
don't want to
terrifying.
change. You kind of do want to change, but you don't want to change drastically, do you?
It's like we're in my clinic, but and I say, people say that, they say that all the time. There's some wonderful things about having ADHD, absolutely wonderful. And I obviously will be biased, but I would tend to feel that kind of neurodiverse people are for me anyway, the best kind of people, really. And I think we bring a lot to society, in terms of spontaneity, personality, being fun, thinking outside the box, and having that ability to sort of see through the conventional sort of crap, and the hierarchical stuff, to actually a fairly simple way in which we could do things better. And I think that often goes wrong for us when we try and explain that to people, but it doesn't mean that it's not a very valuable insight. And then, of course, standing up for justice, that well-known neurodiverse trait. I think the world would be such a worse place without that. So yeah, it's not a question of losing the good bits, is it? It's a question, as I see it, of shrinking the hamster wheel down, helping us to sort of show up and and be able to stick to things a little bit more. And of course, a big thing that no one seems to know about, which is huge in ADHD, it really affects the ability to process language, actually. And I now test people for this because I've noticed it to be a big thing, and stimulants are massively helpful for that. So, in the clinic, and I'm going to say this is everyone because it actually is everyone, in hyperfocus, of course, we're great. We can process language, we can listen, we can do all of the normal things. But whenever we're not in hyperfocus, and that will include when we're feeling emotional or intimidated or tired or not very well or just a bit bored, but also in a group, or if there's background noise, if lots of people, in all of those situations, someone with untreated ADHD is really going to be just faking it. They're not actually generally, from what I see in my clinic, it seems to be a pretty much 100% sample, and it's a large sample as well. And when you say that to people, they say, "Yeah, that's true." I am. everyone in my clinic has the most wonderful listening face. We're all so good at nodding and smiling. We hear the beginning, we hear the end. But it's hard work and it feeds social
Yeah.
anxiety. And I think it brings, I see a lot of massively intelligent people. We've got a big practice at Oxford University, certified boffins, right? But they all, top to bottom of the pile, they all have this same issue. And I think it feeds this sort of feeling of, well, you think I'm intelligent, but inside I'm secretly stupid. And I'm going to really try for you not to find that out. And that's a massive thing. And it's something that stimulants really help with. And in fact, that is why I'm here. That's the whole reason I'm here, because as I tell I tell this story far too more often than I should do, but it's the ultimate experience as to why I'm here. And it comes from my eldest son, really, being diagnosed with autism at 3. Now he's 25 now, so that was a long time ago, right? And one of the things they picked up was language processing problems. He was a good talker, but it was often a bit hard for him to process what was being said.
Mm.
And we know this is the case with autism. It's on the list of diagnostic things. We don't know it's also an issue with ADHD, but it is. And, so he was a bright little chap, but he was often in the classroom in his own little world, not really able to kind of get what was going on. And that was why I went on my quest, like how to help my son. And it's hard to find this. You'll find lots of speech therapy websites and do this exercise and do that exercise. It's really hard to find the information that stimulant medication massively helps with language processing. And so the first day my son got a Ritalin before he went to school, he came home and his little face was like the sun. And I can understand what they're saying in the classroom. It was an absolute, and it was life changing,
Yeah.
and he is a lawyer these days, and that would not have happened. No way would that have happened without them. And that made me so cross that I had to find that out. That why don't people know this? It's too important for people not to know.
Mm.
And yet they don't know. And so that's a massive thing which is behind the scenes that people don't talk about. And yet, I think we all experience it.
Yeah, I mean that's a really lovely example. So does he still take medication?
Well, yes, he
Yeah.
does. Yeah,
So
absolutely.
you see, it's so interesting, isn't it? Because, there is this like, oh, we'll only take the medication for this time or just to get me through this point. But actually, if it's helping, why, like you say, why make your life harder?
Mm.
I had a very similar experience with my daughter when she was diagnosed at 9, and she took the medication, went into school, and no, sorry, we were homeschooling at the time, and she was sitting in front of the screen, and for the first time ever she put her hand up, she answered the question, she did the comprehension, which was what she just could never ever do, and she read it, she understood it, and she filled in the answers, and she just went, "Mummy, it was just like I was like a different brain." And I've
So
never, it
wonderful.
was like light and day, literally light and
Yes,
day for
yes,
her. It gave her
exactly, exactly.
confidence. She would never read out in class. She would be scared to put her hand up. But now we're having issues with the medication, with this, she doesn't like certain aspects of it.
Of course.
Um, and I think, it's okay to tweak things and change things, but to not be afraid, but I think there is an element of fear because it is hard to get those appointments. It's hard to pin down, the doctor who diagnosed you, to then have to be able to kind of go back and say, right, can I tweak this? Can I change that? There's still sort of gaps, aren't there? There's still holes in the way that the process is. Um,
Yeah, huge, absolutely huge. It's not been that many years, has it? And in fact, I still encounter people in my clinic who have been told, "You're 18 now, you don't have ADHD anymore, off you go." Medication stopped, everything stopped. And those people, because they're not eligible now to come back into the child service, they're going to have massive difficulty getting their medication back. And it's only when their life falls apart for a few years that, then they sort of get it together. And it's very wrong. But I mean, my son definitely, like, I wouldn't like to give you the impression that it was all plain sailing with
yeah,
regard to, I think children naturally go through a process of questioning, and especially when they're young, when they start the medication, and my son for quite a while, wondered, and I could see this, did I really have autism? Or did people treat me differently because you were constantly telling them that I had autism? And you can't argue that one, can you, really, in a way? And certainly he did stop the medication for quite a while. And it was only when he nearly failed his probation, at his job. And it was a high level job. It involved sort of court representations and all the kind of things that somebody with language processing issues is really going to struggle with. And I think it was only really when that happened that he sort of had a bit of a rethink, started the medication again, realized that it was obviously really helpful. And now, but I do think it's a hard mental journey, and I can certainly understand why people are asked, and in a way, the more you've been there for them and you've been this wraparound person that kind of deals with all their issues, which of course we will do and we should do, the more they'll be questioning like how much was real. And adolescents and young people, they need their self-esteem. They need that to go out into the world and, conquer the battles that they have to conquer. It's vital that they do think well of themselves.
Yeah.
And this idea that, oh, well, there's something wrong with me, some difference, people don't like it. Whenever I see adolescents in my clinic, I always say to the parents, well, we'll need your score on this as well, because the average adolescent, not many of them will admit to having any problems, because they certainly don't want people to start giving them stuff in the classroom that's going to make them stand out. And in their mind, it's going to make their life harder. So it is, it's a winnable battle. And now, I think 25 has been a very good age. My son and I now have an excellent relationship, but we have had our moments, definitely.
Yeah.
And yeah.
Well, thank you for sharing that. I wanted to ask you, you've got an interest in rejection sensitivity dysphoria, RSD, and we do
Mm.
hear this term being talked about a lot. And I know so many of us relate to it. It almost seems kind of like I've never met someone with ADHD that doesn't suffer with some form of rejection
Yeah,
sensitivity.
agreed. Yeah.
How do you help people with that? And is it just an ability of being aware of it? To be able for people to be able to go, now I understand. Now I understand why I'm so sensitive with friendships and relationships and criticism and feedback. Or is there anything else that people can be doing to help themselves?
I do think awareness is important, and I do agree with you that it's to my mind, it should be on the diagnostic criteria for ADHD.
Can't believe it's
Um,
not.
Well, I think the thing is, there's a lot of established psychiatric diagnoses that would be, it would be a little bit difficult to argue for their separate existence if you allowed this thing to be a thing. Where is the boundary between bipolar, emotionally unstable personality? Where does that sit? And even although I personally don't believe that those are actually real things, I believe that all of that is likely to be ADHD and perhaps various other neuro sort of comorbid sort of things. I think ADHD makes you take a very dimensional view of all sorts of things, that things can overlap. Blue and red can make purple, but that doesn't mean that we need a separate category called purple. It can be much easier for us to understand that it's an overlap, it's a mixture of blue and red. And I think the same thing with mental health diagnoses. So what can we do? Well, I think you're right. Knowing that it's a thing, knowing that we have a slightly different kind of brain and that our emotions will be turned up much higher than other people's. So we can know, like cognitively, that if I feel upset by something, the chances are that you may well not even have noticed this thing that I'm agonizing about. If I think you hate and despise me, the chances are you haven't even considered whatever it was, and it was a thing that mainly happened in my head. Many things I've learned myself, sleeping on it. What a wonderful thing to do. In the morning, things often look a lot better. So I think realizing that we have a bit of a tornado machine in our head is a very helpful thing. But in ADHD, we see it everywhere. And I always say to people, it's like you're on this trapdoor, and however great the day is, however well you've done, you are always like one thought, one memory, nothing at all from just like plunging into this place of self-hatred. And you can't talk yourself out of it. That just makes you feel worse, because now you're this person who can't talk. You might know you're overthinking. I think a lot of us do know that we're overreacting.
Mm.
Doesn't mean you can say, okay, well, I'll just snap out of it then. It does take time. So I think ADHD medication does help a great deal with emotional dysregulation. And in my clinic, what we tend to do is, because obviously stimulants last only a certain amount of time and then they stop working on the day. They work for a number of hours, depending what we're taking, and then they stop working. And of course, when you're thinking about emotional dysregulation, rejection sensitivity, stuff like that, that often feels like a crash. And so people can say, well, that was great, but I had this terrible side effect because I was so allergic to this medication that I suddenly felt like shit, if you use my French, after about 5 hours after taking the meds. And of course, so I educate people in the clinic, this stuff's time limited. you want to keep an eye on how long it works for and what happens when it wears off. Most people, especially most women, will get a crash after a few hours. And I tend to ask them, and it can be a bit of an ask given that people have had bad experiences, to just try adding in an antidepressant like Prozac, whatever your GP is giving you anyway. If you're on antidepressants, you don't have to change. And although they don't work very well, in my opinion, in untreated ADHD, to help with the problems that we have with mood there, once you've got a stimulant in place, if you add an antidepressant to that, it takes the crash away and it sort of regulates the sort of emotional balance over the 24 hours. So pretty much everybody in my clinic will take a stimulant combined with an antidepressant by choice, including me. I've never been depressed in my life, but I do add a Prozac. I take it only about once a week because, of course, the whole point of these antidepressants is they stay in your body for a long time. So,
Okay.
one doesn't have to necessarily take them every day. I mean, I think it depends on choice and, how much we're battling. Very helpful for PMS as well. Once we've got a regime like that, if someone's got PMS, they could perhaps take an extra one on those days. And those kinds of sort of proactive kind of, using medication as a sort of toolkit to help us with what we're going through on that day is very useful. And I mean, there are some other medications as well. I don't know how much you want me to go into specifics, but there's one called clonidine, which Dr. Dodson very much recommends. And I use it extensively in my clinic. This is one we take at night. It helps with the sleep architecture, but it really helps with that sense that the world is a difficult, spiky place where we're just, destined to fail and be attacked all the time. So I think there's knowing about it, things we can do about it. And of course, if you do manage to stop the juggernaut, if your life starts to get better, that gives you the sort of mental clarity and the space to do those things, perhaps to foster those relationships which make you feel good, to have another think about the ones that don't make you feel so good. We're more able to protect ourselves. We're more able to think about ourselves. There's so many ways in which having a smaller hamster wheel enables people to activate the stuff that we all know. Like, I find everyone that I see knows exactly what they could do to make their life better, but they just can't do it.
Yeah,
Because they're too
exactly.
overwhelmed is the thing. So a little bit of mental space, a bit of clarity, and an understanding of what kind of brain we've got and how it actually works, I think, really can go a long way. And of course, success breeds success, right? Doesn't it? As does failure breed failure. So I tend to say to people, the bottom line is do what makes you feel good. If you're doing something and you feel like it's doing you good and you feel better and it's helping you, then obviously do more of it. But if you're, gritting your teeth and in tears and having panic attacks and in the hope that somehow or other doing this thing is going to make you feel better, strongly suggest you stop doing it and take some medication instead. I think it comes back to having that confidence to know whether something is good for you or not, and to ask yourself those questions.
Yeah, I think it's like you say, it's just like, let's use the medication for scaffolding. Let's start building an easier life, a life that feels better to us. And then, great if the medication's working, or if you've sort of created a structure of living that
Yes.
is enabling you to have a new job, or motivate yourself to exercise, or you're able to meet new friends, then maybe, we don't have to sort of take that medication forever, but there's no shame in taking the medication. And I think what you said about using an antidepressant alongside, I think that's incredibly empowering to know that there's options there and we can tweak these options, and we can be at the center of this. Like, the fact that you're able to kind of have this conversation and to the patient, the client, and say, well, why don't we try this, and how do you feel about that?
Mm.
Because it means that we've got choice and we've got ownership and autonomy. And with ADHD, we
Great
like
words.
autonomy.
Great words.
We like this. We don't want to be told what to do. We want to know that we have a bit of control.
A lot of control, Kate, by the
Yes.
way. I would say you don't get anywhere pushing someone with ADHD around you. You can guarantee that if you're, imposing something on someone and telling them how you're going to fix them, the chances of that thing working are so much smaller than if the person chose it themselves. So it's a vital thing of treatment, I think, that people need to feel autonomous. And in my treatments are very much a day by day thing. Like, you take it one day, don't take it the next day. Do exactly what you want. It works when you take it. doesn't work when you don't take it, but we do have, and I think one of the great arguments for this now, I've noticed it in myself, really after quite a few years of taking medication daily, I've just noticed that I don't need as much as I used to. And there is literally nothing in my head that says you should stop taking, or you should take less, or you should wean yourself off. I have no belief about that at all. I think I should have the best life I can. I should take medication that makes me feel better and gives me a better day, but I just don't need as much. I don't even need any of it as much as I used to. I think possibly if I stopped taking it altogether, I would expect that maybe after a few weeks or whatever, things would start to go downhill again. But, I've been on medication now for 13 years. And of course, my life has changed a lot as well, a great deal. And my life is built around my ADHD brain, really. Things I do things that are good for me, and I don't do things that are not good for me, right? As much as possible. So it has made it a lot easier, but neuroplasticity. And I think it doesn't mean we're necessarily going to stop taking meds altogether. We can do if we want to. Quite a few people in my clinic, especially though at school, they don't take medication in the school holidays. You need it in the classroom. You absolutely need it in the classroom, because the classroom is very disadvantageous for neurodiverse kids from the auditory processing point of view. It's a group, noisy, etc. I don't think any of us can listen in the classroom, really, unless you're have the kind of massive hyper focus on the subject that I think I've only found as an adult. When I go to lectures about ADHD by people that I'm interested in, I can listen. It
Yeah.
doesn't hurt that I take a stimulant before I go as well, but I was never able to listen to anything in the classroom before, and I think we succeed despite the way the education system is, rather than because of it. So yeah, I do think it has to be a choice, but I think it's a real shame that we see this grouping where you've got evil medication on one side and wonderful exercise and meditation and vitamins and fresh air and light, and you name it, all these wonderful things are there which we should all do. And then there's the evil medication, and that's the one we shouldn't do. And it's kind of ironic that that's the one that has the biggest effect size and sort of enables us to really get the most out of all the other wonderful things that are there, because it's very hard to sort of do meditation if your brain is a jumbled washing machine, that's 10 times the size it should be. And you run the risk, people try and do it's so classic, isn't it? People go through these cycles, don't they? The stuff they try to do, we start this thing, we go to the gym every day for 3 weeks, fantastic. And then one day we don't, and then we just don't go there again. And it just adds to the shame and the self-hatred. But, we have to give ourselves a bit of space and a bit of understanding, because if we don't, nobody else will.
Yeah. Thank you so much for giving us your expert opinion. Obviously, we sort of talk about medication on the podcast, but I'm hesitant to do so. I'm not a specialist, and it's very rare that I manage to get a doctor, a psychiatrist on the podcast and really talk with authority and allow people to really have a professional understanding of the medication, and also validation of this is why I've been fearful. But actually, after this conversation, hopefully people might kind of think, what, I might go back to my consultant and, maybe try it and, feel a little bit more supported that they've had, they've heard this conversation.
Oh, can I just give one last tip? I'm just thinking, anybody thinking about medication, there's one really simple thing you can do, right? And people do not know this. If you go onto the internet and you look up physical symptoms of anxiety, put them on a page, print them off. When you get your medication from the clinic, observe how much the first half of that side effect leaflet is exactly the same. And also, many people are very sensitive to meds. If you're the kind of person that has a couple of coffees and go very palpitative, very anxious, right, you have to go slowly on your stimulant. You will get there. But of course, a stimulant is rather like having a coffee, only it's like having quite a lot of coffees. So if you're going to go funny and you have one coffee, then break the tablet down. I think a lot of specialists don't know that. Unless you're on the medication yourself, you're not necessarily going to appreciate that. But that on its own will make a huge difference to people's experiences with medication.
Oh, that's amazing. Thank you for that. Because you were literally just describing me. So yeah, that's really interesting. Thank you. With regard to, I know you're seeing a lot of women with perimenopause that are coming through to you. I found that the HRT has really helped me. It really did. You know, at the age of 42, I went on it last year, and that has helped me enormously with my ADHD, alongside with lots of lifestyle things. I've been on medication, I've been off medication. I'm still toying with the idea of going back on it. Right now, I don't think I need it, but I'm not sure.
If you don't need it, then don't have it, sort of thing. I mean,
Yeah,
it's got to be a personal choice, hasn't it? If things are going
yeah.
well.
But
Yeah.
because I really noticed that the my ADHD was a lot worse for, the last 2 weeks of my cycle.
Yes.
And that's a long time, half the month feeling not not great.
Totally. Yes.
But that HRT has really helped me. And what you were
Yes.
talking about with regards to tweaking the medication, my doctor said the same to me. She said, well, if you need another pump of the estrogel, just do another pump of the estrogel at the end of the month. And I was like, wow, okay, so I'm allowed to do that. So I was like looking around for, like, being told off it. But that's what's interesting, isn't it? Is that we are, just because we're the patients and we're not doctors, we can still make decisions and choices, obviously in a safe, way, and making sure that we're not doing anything that we shouldn't. But it is okay to tweak things, especially as women with our hormones, isn't it? Are you noticing
Totally.
this with medication, that women are, if they have got really bad PMS or PMDD, they can up the medication?
And I tell them to. I very much collaboratively work with people in my clinic, because I've noticed that no person, certainly no person in my clinic, and probably no person with ADHD, is actually ever going to take too much medication. Right. The battle is, can we get them to take any? And then the second battle is, can we get them to, well, not that it has to be a battle, but, if obviously if they're struggling, then, it's hard to get people to accept that this might help. And it's a shame if they're struggling. And then can we get them to take enough to be optimized? So, I very much do say to people, look, you are going to know more than your doctor about this. After this consultation, and you are the expert on yourself. And yes, it's classic that people will find if they have PMD, their meds don't work so well. And I often find it's actually, if you're combining it with an antidepressant, increasing the antidepressant rather than this. I mean, you can increase the stimulant, like, why not? But if it works for you, but that's obviously a bit harder to negotiate in terms of shared care with a doctor and stuff like that. But taking 2 Prozac rather than 1 on those days, like, we can all do that, right? If you're on something of that kind, and that often helps quite a lot. And knowing as well that things are harder during those days, and also, like, we're more likely to crash into the furniture on those days as well. I think people don't always realise that, but that seems to really go with this kind of issue, doesn't it? So getting good kind of HRT, good PMS, PMDD care is really good, but stimulant medication makes it work better, I would say. And because I see it as a giant hamster wheel situation, I think if your hamster wheel of your life is too big, that is always going to be a problem for you. And, it's going to make your life more stressful. It's going to make everything a bit harder. So if we could shrink that down to a normal size, then really any condition that we have, the treatment is going to work better for it, because we're going to be less stressed, we're going to be happier, we're going to be winning more than we're losing, which is obviously very good for the dopamine, right? We love winning, don't we? We don't like
Yeah.
being told what to do. We like feeling good at our job. We like to feel that we matter and we can make a difference. And, we like that autonomy and that freedom to sort of live our lives in the way we think fit. And there's nothing wrong with any of that, is there, really?
Yeah, I mean, this has been absolutely fascinating, and I feel like I would love to do a whole other episode with you on lots of other things that we haven't managed to cover. Because your knowledge and your insight and your experience is so helpful for so many. So I just wanted to thank you so much. Um, are you taking on new patients?
We do get a lot of referrals, and I've recently taken on a doctor, lovely doctor, Dr. Imogen, to work with me, who's absolutely fabulous. So, because of that, we are able. I mean, we're taking patients on, but my clinic's booked up till next February, for example. So that's quite a long time, isn't it, for people to wait? Dr. Imogen's only recently come to us, and she's also offering more sessions than I am. Yeah, by all means, if you want to, if people want to come along, we do get a lot of referrals. We don't advertise. People just, this is a family business, isn't it? Really, it's a family condition. So often one person comes, then someone else
The rest
comes,
of the
other members of
family.
the. Yeah, you do. You have lots, and it's lovely. It makes you feel part of something bigger, really.
What's the website? How can people find you?
ADHDconsultancy.co.uk.
Nice and
But you could
easy.
also Google me. Absolutely. So yes, do come along and let's get this sorted, right? Let's start living a bit of a better life.
Yeah, absolutely. Thank you
Yeah,
so much for your time, and we'll definitely speak again.
absolutely. It's been amazing. Thank you so much, Kate. Thanks, listeners. It's been really nice to talk to everyone.
Thank you so much for joining me on today's episode. I hope you found what you were looking for in this conversation, and it's helped guide you towards some further self-healing, self-exploration, and most importantly, self-acceptance. And if you have enjoyed this conversation and would like to experience more of my work, such as access to exclusive live workshops and opportunities for group coaching sessions, connecting with other like-minded women, and a general feeling of belonging, please come and check out my monthly membership, the ADHD Women's Wellbeing Collective. I've made it as affordable as possible, and I offer you lots of resources and opportunities for connection and support from other women all around the world being diagnosed with ADHD later on in life. I'd absolutely love to see you there. All the details are in this episode's show notes or on my website, adhdwomenswellbeing.co.uk. See you in the next episode.